Okay, well, let me introduce you. This is Leslyn Keith. So we actually haven't formally met until now, but I met you as you were presenting at the Obesity Medicine Association when beginning of April, so about a month and a half ago.
Yes.
And I've been trying to take care of lipedema for a while in my practice, and it's very challenging sometimes.
I'm just
Well,
stunned that you knew about lipedema because there's so few physicians that even could are aware of it. So I'm so pleased to find that there is someone who knew about it and that you were at least trying to help these patients. Thank you very much.
oh, well, thanks. Well, thanks. I don't consider myself by any means an expert, but we have gotten quite a few patients down the through the journey to get surgery done and other treatments in the meantime too. So, and if you hear anything, I've got a 2-year-old, so we might hear a little bit of screaming or laughing in the
It's
background,
real
depending on what her
life,
mood
right?
is. That's right. That's right. Well, let me do a quick bio intro to you, all right? Because you sent over some info, because I mean, we haven't been working together. I don't know you personally, so I had to look you up a little bit. So let me see if I get this
Okay,
right. So you're a certified lymphedema
great.
therapist. You've been doing that for over 25 years,
Hmm.
right? Your base certifications in occupational
Yes,
therapy. And the CLT is the Certified Lymphedema
right.
Therapist. Okay. And then author. I started one of your books, the Lymphedema
The
Code,
lymphatic code, yes,
the Lymphatic
yes.
Code. Yep. So I'm getting to that. Very helpful and instructive. I haven't gotten into the other one yet, but two books, right?
Yes, but specific to our topic today, I just published. I was one of three editors for Lipedema, Principles and Practice of Diagnosis and Treatment. So I was one of the editors with
Very
that,
cool.
and that just came out a couple weeks ago. So that's a pretty amazing medical textbook.
Okay, cool. Slipped under my radar.
Mhm.
So we'll post the link on our description here of the podcast after. Well, that's really good. And you've been doing research in lipedema and lymphedema.
Yes.
Okay. And then tell us a little bit about Lipedema Simplified.
So that is an organization that was started by Catherine Seo. Oh my gosh, quite a few years ago because of her own journey that she was trying to figure out what was happening to her body. And so she and her physician and another physician, Dr. Mark Smith, kind of embarked on that journey with her to figure out what it was. And it was finally diagnosed as lipedema. And she thought, I gotta help other people know, maybe hopefully shorten their journey to figure out what's going on. And so she started the organization Lipedema Simplified and started just a lot of awareness activities and support activities that it's now helping a lot of women worldwide because we do everything pretty much online. So it is been very supportive of me and what I wanted to do with research and reaching as many people as possible. So I've been a consultant with Lipedema Simplified for, I don't know, at least 10 years. So been doing a lot of work with Catherine and the team.
Yeah, that's amazing. I actually have patients come in and say they've been listening to those podcasts and the videos that she's making.
Wonderful.
And that's what clues them in and into what they have. And
Hmm.
so they come in asking for care.
Yes, very good.
Yeah, so that's a great step, actually. It seems like one of the biggest problems here is just knowing that it
Hmm.
exists. Just the basic knowledge of that it's a thing,
Yes,
you
yeah,
know?
because it appears like obesity. And one of the basic premise of my talk with Dr. Carmody at the Obesity Medicine Association conference in April was that these are two distinct diagnoses, and there can be overlap in treatment, but there's a lot of distinct different treatments that you use. And so if you're trying to apply that diagnosis, an obesity diagnosis, to someone who has lipedema, they're going to be trying and failing. And unfortunately, to a physician who's not knowledgeable, often these women just are not believed. They decide, oh, you just must be not doing what I'm telling you to do because it's not working.
Yeah, that is so frustrating. These patients have been some of the most proactive patients I've ever met in my life.
Yes.
These women are coming in after years and years and years of trying and failing with their with being able to fix things just with what tools they have, and they are ready to make a change or ready to get care.
Yes.
So my props go out to everybody who's affected, because I'm seeing so many patients here who are doing amazing work with their own health. It's really cool. So should we set the stage for lipedema by just telling people who may not know about this what it is and what it looks like and how they can identify it in themselves or maybe a family member or a friend or something?
Yes, very good. So it is known in general as a painful fat disease. So those are the two predominant features, is that there's excessive adipose tissue, usually confined to the lower half of the body, but it can also be on the arms. And the fat tissue is painful. And in another paper that I wrote trying to identify lipedema, we talked about that those two features are defining characteristics, but we modified it to be pain or hypersensitivity, current or historical, because many women with lipedema have figured out treatments, interventions to do that help them with the pain. And so they used to have pain, but now they don't. But I say they still have lipedema, even though they no longer have the pain diagnosis. And the other thing that happens is that when you have a lifelong condition with pain, your brain starts to suppress your acknowledgement of the pain. And so they could go into their physician and say, you know, on a scale of 1 to 10, what's your pain? Oh, I don't have any pain. And so they actually do when you question them further, but they have decided, no, I don't have pain. They think that everybody has pain when you do a blood pressure cuff on the arm. It could be excruciating for someone with lipedema, but doesn't that happen to everybody? So I don't have anything out of the ordinary. So that one feature of pain can take a lot of digging on the part of the physician to really get an accurate picture of that. But then we look
But that one symptom, let me just jump in really quick here. We have patients who come in, I remember hearing that for 20 years and never having a frame of reference on the blood pressure cuff hurting.
Yes.
So I just want to throw that out there as a teeny little clue that can tip you into this, because you can see those arms.
Yes.
They definitely have excessive fat tissue on the extremities
Yes.
there.
Yeah. And so one thing is then the texture and the look of where they have lipedema. Usually, like I say, in the lower body, could be the whole arm to the wrist, or it could be just the upper arm. If you will press in and palpate, which can be painful, but pressing in there and kind of rolling the tissue between your fingers, you can feel these little nodules. It is not smooth fat tissue like it is with obesity. With lipedema, you can feel those nodules, and they can be little chickpea size, or they can be larger, like a walnut. And that will be, typically is going to be in the hips, the buttocks, the thighs, sometimes also in the calves. But the other issue with lipedema is it can present so differently because sometimes lipedema is only in the hip and the buttock area. Some people it happens all the way to the ankles. I already talked about the different places it can appear in the arms. But the hands and the feet are not affected. So the other thing that can make it confusing is if they also have a condition that causes their hands and feet to swell, like lymphedema or chronic venous insufficiency or something like that, then the physician who knows a little bit about lipedema can look and say, well, I see an issue in your hands and feet, so that's not lipedema. The problem is that we get all of these comorbidities, right, that cloud the issue and make it even more challenging to diagnose.
So that's someone with lipedema and lymphedema at the same time.
Or maybe they have hypothyroidism and it causes their hands and feet
Right.
to swell. I mean, as you were speaking to already, it's a challenging patient to tease out what is actually happening with them.
Yeah, it's a really good point. And our patients feel that same challenge
Yes.
too, the frustration and the lack of diagnosis, lack of treatment.
I will say
Yeah.
another interesting feature, and you already spoke to this, a person trying and failing lots of treatments. Typical treatment for obesity is to diet and to exercise. And many women with lipedema have used calorie restriction, to starvation levels, have exercised like crazy, and it has absolutely no effect except in their face and their trunk. Their areas that have lipedema, there's no change to. And so quite often that could be diagnostic when you're finding that they've tried these various things and, oh, okay, that's one of our clues. Another clue is onset at puberty, pregnancy, or perimenopause. Those times when hormones are changing seems to be a big trigger period for these patients. So you're talking about their history, their medical history, their symptoms that they currently have, and that's what we got right now to put together a diagnosis.
Have you ever seen a man with lipedema?
I have not, but there was a wonderful paper that just came out of Brazil. Dr. Amato, who does a lot with patients in Brazil, had 5 patients in his clinic, males and he said they have all the characteristics, but it is predominantly, almost exclusively with females, but definitely there are men that can have the condition.
Wow. Yeah. My experience too. I haven't seen any men with it. Although every once in a while we see men with big old tree trunks for legs. And I kind of wonder what that's from.
Yeah.
So I don't know.
They say right now that it seems like it's, for men, it's coupled with a hormonal issue, that there is an imbalance, a hormonal imbalance, and as soon as that's corrected, a lot of their lipedema symptoms go away.
Yeah. Yeah. So we have 11% of women in the world with lipedema. Is that a correct estimate?
It could be. It's really hard to know. And that original 11% estimate came out of the Foldy Clinic in Germany, that 11% of the patients who had been referred to them for lymphedema treatment, actually they ended up diagnosing them with lipedema. And so this was probably not a good sample for worldwide. These were all people who thought they had lymphedema. And so it may or may not be accurate. I've seen other papers that say about 1% and some even higher than 11%. So at this point, it's because there's a lack of awareness, and there can be some variability in a definition of lipedema that we don't really know for sure, but it's probably, a lot. A lot of women
Yeah.
have this condition.
So if there's 300 million people in the US, whatever the most recent number is, even if it's 1%, That's 3 million people
Yeah.
suffering with the disease.
Mhm.
How many of those do you think have been identified or know it themselves that they have this, that they have actually a medical condition?
I would say that it's more and more now than ever before, but I would say predominantly most women who have lipedema don't know it. But we're improving awareness. For instance, June is Lipedema Awareness Month, and that's when we do a lot of organizations do stuff during that month to try to promote awareness among physicians, among people who might have the condition themselves. So I think it's improving, and the internet is huge in that. I can't tell you how many women have told me that they just, on a search engine, they put in big fat legs, you know, and then boom, they just start seeing pictures of people who look like them, and they see that word lipedema for the first time. So it is getting out there. I think it's better, but I think there's a lot of people who do not know they have lipedema.
Yeah, it's so good to spread the word. And, you know, if people want to get treatment, if they have access to that, I mean, they deserve to get some kind of answers in what's going on.
Mm-hmm.
It seems like the the patients that I'm getting to, I mean, it's a wide range of ages, but when I see somebody that's in her 70s or 80s and I see lipedema, I just hurt for them.
Yes.
I mean, a life full of pain. Most of them affirm that, yeah, they've had leg pain, arm pain their entire
Yes.
lives and just thought that it was the normal. So
Mm-hmm.
it'd be nice to get to those patients years and years earlier.
Sure, sure. And what we're finding is in our community at Lipedema Simplified, a lot of times we're mostly reaching those postmenopausal women in that stage you're talking about. And because they've become aware, now they can talk to their daughters and their granddaughters and hopefully help them earlier if they're starting to see that in their family. So these women who have suffered in decades, an entire life, they are, like you say, they're some of our best patients. They are reaching out and trying to help other women.
Yeah, it'd be great to spread the word even more. So that's why I think it's super cool what you guys are doing, and you're out there online. Everybody who I'm seeing has looked at the website, has looked at the pictures.
Mhm.
The pictures are amazing to see how bad lipedema can actually get.
Which we
I
try
mean,
not to be alarmist, because not everybody with lipedema is going to progress to those, worst points. But hopefully you become aware of it and you stop the progression and maybe even reverse the progression. But some people just never even get beyond stage 1.
yeah. You know, as I'm walking around town,
Mhm.
going different places, doing different things, I see people all the
Mhm.
time. And a lot of people who are walking really slow, and you can see it in their
Mhm.
hips. You can see um, the the interference with their walking.
Mhm.
I mean, it's visible, and and you know these people have lipedema, and I kind of just want to go up to them and tap them on the shoulder and say, "Hey, did you know this?
Mhm.
If you did, great,
Mhm.
but if you didn't,
Yeah, and that
this
that's
is
a
something
that's
to
a
know
really
about."
tough thing. I found that it's better to come from another woman who has lipedema, because people who are overweight and obese, as you know, as that kind of a physician, that they've had people walking up to themselves, a skinny, svelte person coming up and say, "Hey, I think you've got such and such, and you should do this." But if you get approached by someone who looks like you, then it doesn't feel so judgmental. And so at Lipedema Simplified, we've tried to make little postcards that have information about lipedema. And if you are someone who has lipedema and you know that you have it and you're getting help, you can approach someone who you suspect might have that. But from you and I, it's not always, it can be hurtful. And we try to be as supportive as we can of people.
Yeah, it doesn't feel quite right
Yeah.
either. Yeah, you're right. Well, so without taking the whole time on just the treatment options, why don't we do a quick overview on what kinds of treatments are out
Mhm.
there, just so everybody can get an idea of what the options are.
Yes, yes.
So, where does someone start?
Yeah, to start with, I would highly recommend that you find a certified lymphedema therapist, and unfortunately there's no certified lipedema therapist yet, but lymphedema therapists have also usually had training in helping someone with lipedema. So that is, and there's lots of listings, of provider listings to find that online. I would recommend going to the Lymphatic Education and Research Network, Learn. Their, I got to get you their website, but I will give you a link through there, and through their listing, they give you, if you click on Find a Therapist, they will tell you how to find a provider in your area, but they also tell you the questions to ask to make sure that what experience do you have with lipedema? What do you do for someone with lipedema? So I find that website to be very helpful to find that person. That is going to be your first line, is have your physician refer you to a certified lymphedema therapist in your community, because that person is going to help you figure out, well, should I be getting manual lymph drainage, which is a gentle massage? Should I be getting some kind of compression therapy? Might I use what we call a compression pump, so an intermittent compression device that I can have at home? What kind of exercises should I do? How can I reduce my inflammation and help reduce the pain that I'm experiencing? And then there's lots of complementary treatments that are not necessarily covered by insurance, but they're lovely things you can do on your own, like applying vibration to your body and various things like that people can do. They don't have to go into a visit to see your CLT. A lot of stuff you can do at home that can help you feel better. So the non-invasive stuff, which I think a highly important piece of that is going to be nutrition, reducing your body inflammation in general through nutrition. So getting that kind of guidance is going to be huge for the person. Now, say you've done all that, and
That's the Lymphatic Network, by the way.
lymphaticnetwork.org.
Lymphaticnetwork.org.
Yes, perfect.
Yeah.
Yes. So we'll make sure people get that. So that's going to help you find that CLT. But if you've done all these things and you're still having significant issues with your lipedema, and this is usually going to be pain and mobility limitations, then we might be looking at surgery. This might be an additional help for you. And so, again, go to your CLT to find out, well, who are the surgeons that I should be contacting and seeing if that is for me.
It's a great overview. Let's put some light to some of these. So, with the certified lymphedema specialist therapist in our area,
Mhm.
there are actually several. Some of them take insurance and some of them don't.
Yes.
The ones that take insurance, there's actually very few.
Yeah.
And so there's some limitations there just because of finances and other
Right.
things.
Right.
So for us, there's some logistical issues.
Yeah. So and it might be that you only are able to see that person once to get a full evaluation and to get their advice. I recommend that you're going to get this kind of compression garment and maybe get this compression pump, and start doing some vibration, and maybe get into a water exercise class. So it might be, if you don't have someone who is a specialist that is covered by your insurance that you can go see, it might be that you go once to that person that's covered by your insurance, and then you don't get to have the benefit of having treatment by that person because it's going to be too costly. A lot of, because there's massage involved in the treatment, massage therapists will get this training and this certification, but quite often the massage therapist is not covered by your insurance. So that may be what's happening in your area.
Yeah, there's a lot of practitioners locally, or the ones that are certified, are actually very, very interested in treating patients and compassionate, and everybody loves going to them, but there's just those logistical barriers still.
Yes.
But so let's talk about nutrition, because this is an area that you have really dug into. I mean, you wrote a book on the keto diet for lymphatic management, and then the lymphatic code has a lot about keto diet. So talk to me about the diet and what effect that has on lipedema.
Great, yes. I started out, my focus was on lymphedema. And there was a huge correlation between obesity and lymphedema being worse. And so I was really focused on my patients who had obesity, which it was like 3/4 of them, and helping them lose weight so that their lymphedema would be better. But I quickly found out that there was more to it, because even my patients that did not have overweight or obesity, they were eating fewer carbs, and their lymphedema was getting better too. So it wasn't just related to weight, it was more the health of the tissue. And Dr. Amato, the surgeon in Brazil, he believes that it's really related to inflammation. So reducing the inflammation seemed to make the lymphatics work better, and it helped with a lot of symptoms for lipedema, including pain. So when I met Catherine Sao at an NIH conference in Bethesda, I think it was in 2015, I was presenting my pilot study on using a ketogenic diet with patients with obesity and lymphedema, and she said, "Do you think that would work for lipedema?" So we said, "I have no idea, let's try." And so we started talking about it, and doing a webinar. This was when webinars were still pretty new, but we had lots of women who had, most of them self-diagnosed with lipedema, and we were saying, "I'm not sure, this is what I use with Dr. Eric Westman, this is the diet that he recommends, and it's great for obesity, try it." And we just had people that were just doing that on their own, and then coming back to us and say, "I lost 50 pounds. I've never been able to lose 50 pounds on any kind of diet before." So Catherine and we brought together really a good team of about 10 different experts from around the world, Germany, Spain, Italy, and US. And we wrote a paper about, well, a ketogenic diet seems to have a lot of potential for lipedema. So we talked about, it was published in Medical Hypothesis, because we're saying this is our hypothesis and this is what we think might be the mechanism. And so we published that 2020 or something like that. And since then, based on that this is our hypothesis, there's been all these randomized controlled trials and clinical trials with women with lipedema, and people are pretty stunned with how it has come out, because the previous diets have not been successful, but this way of eating seems to reduce the pain, reduces the fat even in the area that has lipedema. So all these benefits beyond the scale, although the scale's going down too, but all these benefits, it seems to be addressing the core symptoms and characteristics of lipedema, and they're doing better. So a more recent trial out of Poland, they actually looked at blood numbers. because there was a lot of concern by physicians. Well, it's okay to do that for a short term, but is it really healthy to do that long term? And they found in this group of women using a ketogenic diet that their blood numbers were actually more favorable. Although women with lipedema tend to have pretty good blood numbers to start with, that is so different from the typical patient. If they have lipedema with no obesity, with no abdominal obesity or visceral fat, they just have lipedema, they tend to be really metabolically healthy. But
That's crazy, isn't it? I've seen that
yes,
too.
yes.
Like
I mean, it's better to
liver
have,
numbers normal, cholesterol levels.
yes, yes, better to have
Yeah,
your fat low, right?
just not,
Yes,
it doesn't cause a metabolic disorder.
yes, yeah.
Yeah.
But we're seeing that it could be 70–80% of women with lipedema also have obesity. And so now they don't have a favorable blood panel. They use a ketogenic diet, their blood panel improves, and they lose a lot of those unfavorable characteristics, that pain and stuff like that with lipedema. So now they're starting to change their mind. Maybe this would be something good to do long term. I mean, a lot of the patients are saying, okay, you've told me I shouldn't do this longer than 6 months, but I'm not going to stop because I feel so much better.
Wow. Yeah. So, so honestly speaking, in my practice, our patients really struggle with a very restrictive diet, like the ketogenic diet.
Well, and this is what's interesting is that now one Poland study out of Poland, they compared a moderate carbohydrate and to a low carbohydrate diet. And even the people who just went down to like maybe 150 grams of carbs per day, not all the way down to 20 of a ketogenic diet, those people who just went down to 150 did better. Of course, they did even better if the lower they got, but it showed that you can be on that spectrum and not feel like it's totally restrictive and do better.
Okay. Yeah. I mean, that's really cool.
Mhm.
But I was also thinking about this, like if it's worth it, it might be worth the extra effort.
Mhm.
You know, if they're really going to feel that much better.
Yeah. But maybe they need to test the waters, so to speak, and
Right?
see, because it is kind of unbelievable. You know, just by not having sugar and starch, I'm going to feel better with something that's plagued me for 30 years. It seems unbelievable. So maybe they just need to test the waters, and when they start feeling better, okay, maybe I'll do even more. But I mean, that's been my experience in my practice, that when I first suggest it to people, they don't believe me.
Well, that's a pretty good approach. I mean, then you allow them to actually see the benefit before they make a long-term commitment.
Mhm.
It is hard to follow a restrictive diet. There's carbs everywhere out there.
Mhm.
So, yeah, but hey, if it really is that
Mhm.
good, maybe we should be doing it
Yeah,
more.
yeah. I think it is,
Yeah.
in my practice with both lymphedema and lipedema, it's been extraordinary for the people that are able to do it. And we need to be individualistic. I did write a paper with Siobhan Huggins and Carrie Reedy, a nutritionist, and we talked about specifically that. You need to take in the person's culture, any social challenges that they have, psychological issues, all their comorbidities that they have, when you're helping them put together a way of eating that's going to work for them. You can't just come out with a standard, here's the recipe, do this or do nothing, and expect them to be successful. We have to incorporate, if it needs to be kosher, if it needs to be, okay, but I don't like bacon, okay, so don't have bacon. So it needs to be something that is pleasurable, hopefully, doesn't feel like it's they're being denied stuff. You want them to feel satiated. You don't want them to have cravings. You know, these are all of the issues that have to be worked with so someone can sustain it.
Yeah. Okay. Well, it's great to hear your personal experience with it, clinical experience, to know that these patients are actually really improving,
Mhm.
and that's amazing. So, are you seeing fat loss in the extremities with this diet?
Yes, absolutely. But I will tell you that many of them still have, you can kind of see a vague lipedema shape. So they are smaller. Maybe it's a little bit less of a wrist or an ankle cuff, where it abruptly stops. Maybe that's not as severe as it was, but you still can, for a trained eye, you would go, okay, this person has lipedema. So, and then we put on a compression garment, kind of a shapewear type of thing, and things smooth out, and they feel better and more normalized, I guess you would say. So it is, yes, I think we do, but there might be obesity fat mixed in with the lipedema fat, and maybe what we're doing is only reducing the obesity fat. It's going to take a study where you actually take tissue samples of people who have lipedema and see if those two types of fat reside in the same body area.
Yeah, there's an idea.
Yeah, and
Yeah.
I wouldn't volunteer for a tissue sample. So, I mean, this would be be very grateful for women who do this. But that's a kind of, how are we going to find out if the two types of fat can be in the same area, or if they really are divided to, this is only lipedema fat below the waist and obesity fat above the waist. We just don't know.
So we're also treating a lot of people with medications too. And we're finding with the GLP-1 medication specifically that people are having less pain in their extremities. And it looks like they're losing extremity fat as
Mhm.
well. Um, do you have any opinions on that so far?
Well, of course, I'm an occupational therapist, so I'm not prescribing that, but I know many women with lipedema that are using this, and there seems to be a variable response, just like there's a variable presentation of lipedema, which it may turn out there's lots of different types of lipedema, but it seems like for some people it really has a good effect, and others not so much. But as with a practice where you're specializing in obesity medicine, you are helping people with all their different markers of success and not just the scale. And so when that person who's using the GLP-1 or any intervention, you're looking at pain levels, you're looking at measurement, physical measurement of the limb with a tape measure, you're looking at a body composition test, you're looking at skin texture, tissue health, all kinds of markers, and not just the scale. And people who are using GLP-1s, often they're watching that needle on the scale, and if it's not going down, it's not working. But there could be lots of other good things that are happening.
Yeah. Yeah, a lot of our patients with the medication, but with a lot of other treatments as well at the same time, compression,
Mhm.
garments, compression
Mhm.
pumps, the dietary changes, a lot of them are actually feeling a lot better. I have a little section on my website that has a lipedema section in one of my patient pictures, and she's actually getting quite a bit better
Excellent.
with
Yeah.
lipedema, but it doesn't look like it's going all the way
Yeah.
away. So anyway, hopeful in the future for that kind of treatment.
Yes.
Um, I'm not really clued in much on vibration,
Mm.
so tell me more about
Yeah.
this.
So, vibration for just health in general, there's been some actually really good research that's showing that it can improve bone density. It's almost like exercise in some ways. It improves circulation. So they found that in general. There hasn't been, there's only been one study that I know of that actually looked at women with lipedema using vibration, and they did find some improvements in, I think, blood and lymph circulation and maybe decreased pain. Anecdotally, clinically, I've seen patients that it just really helps them. Sometimes they will use whole body vibration. You stand on a vibration plate and it shakes your whole body. For some people, because of their comorbidities, that's a little bit too much, and they prefer either to sit in a chair and just put their feet on the vibration plate, or use it in some modified way, or use a handheld vibration device and direct it to maybe an area in their body where they have pain, maybe an area where they have fibrosis in the fat tissue and they want to hopefully soften that up and allow better drainage. So anecdotally, clinically, we're seeing that women with lipedema and lymphedema can have a lot of benefit to vibration as long as you find a way that works for you. It should make you feel better, not worse.
Yeah, interesting. We better try that because I'm not really using that much.
No, so a lot of the vibration plate companies will be very interested in providing you with a plate and having it in your clinic and having you try it on your patients. I had one in my clinic. I didn't have to buy it. They gave it to me to try on my patients. I had several patients that really loved them. Others like, no way, it makes me dizzy. But other patients, they actually found a benefit, and so they would hop on it whenever they came in. You only use it for 5 or 10 minutes. It's not
Okay.
a huge thing, but having the ability to try that out at your doctor's office before you go purchase one on your own is hugely beneficial, because you don't want to put out that money and then find out, oh no, this doesn't work for me.
Great idea, actually. Um, do you have any opinions on vitamin supplements
There's
for
been a
this?
little bit of papers written on that, and there is some work that showed that, for instance, like selenium, women with lipedema tend to be low. Both lymphedema and lipedema tend to be low in vitamin D, even lower than the general population. Seems like most people are low in vitamin
Okay.
D. But so I think it's most beneficial, rather than guessing what you need, maybe you want to do a full micronutrient panel and see what you're actually low in and address that. But like I say, has been some papers done that seems like women with lipedema tend to be deficient or insufficient in certain nutrients. So it's worth looking into with the patient.
All right. Are you working with anybody who's taking diosmin or horse chestnut? There might be some others out there.
Yes. Yeah.
I just don't know how effective those are for treatment.
Yeah. Anecdotally, again, I'm not sure that the research that has been done on those, but I mean, anecdotally, I do have patients that feel like they really help. I can't remember what the actual name is for Mucinex.
Oh,
That,
yeah, guaifenesin,
yeah, that,
the ingredient
and
name.
that one seems to help. And interestingly, some of them actually have anticoagulant properties. And there has been a lot of papers on that lymph can clot just like blood. And if your lymph is clotting, it's not going to drain properly. You're going to get congestion in an area, and that's going to add to your pain. And so maybe this is a mechanism why some of these supplements tend to help. Maybe it's just reducing the clotting that's happening in your lymph. We really don't know. But it does become important that if you want to go have a surgery, you better not be taking one of those medications that are going to interfere with your ability to clot.
Okay, good advice.
And I did have one
Uh,
person who told me that when she took, what did you call the Mucinex? Yeah,
Guaifenesin.
when she took that, it exacerbated her bipolar symptoms. So It's just because it's
Okay.
over the counter doesn't mean it's safe for you. You know,
Yeah.
talk to your doctor, make sure it's going to be okay.
May not be
Yeah.
innocuous. Well, we better talk about surgery. Um, so I know you're not a surgeon, I'm not a
Mhm.
surgeon, um, but we have patients who have gone to
Mhm.
surgery, right? And gotten the liposuction technique specific for
Mhm.
lipedema. So, what is your experience seeing patients before and after surgery, and what would you want people to
Mhm.
know in terms of whether it should be
Mhm.
considered?
So, um, I've had a lot of patients with an incredible amount of success with surgery, and usually these are people who have tried, as I said, the conservative treatments first, and sometimes that's even required before you can get covered by your insurance. But a lot of people have paid out of pocket to have the surgery, so which can be quite expensive. But I think the key is to consult with more than one physician, surgeon, and also to go to a reputable website to know that you're going to a surgeon that specializes in surgery. Typically, they're going to specialize not only in liposuction for lipedema, but they're also going to be specialized in the microsurgery for lymphatic stuff for lymphedema. So that is the person I would want to go to. I wouldn't want to go to a plastic surgeon who only does liposuction and is not really familiar with all of the lymphatic anomalies that can happen with lipedema. There is something called lymph sparing liposuction, something that is going to be gentler. It's still going to have some assault to the lymphatics, but it'll be gentler on the lymphatics, maybe a little bit less post-surgical swelling. So I think it's really important to consult with more than one surgeon, figure out who is going to work best with you, and understands all of the conditions that you have besides the lipedema, to make sure that you're really well cared for. And what are their pre-surgery and post-surgery protocols? I've had several patients that told me that there is no contact after the surgery is done. And that, I think it's very, very important how this person is helped and monitored after the surgery. And if that's the surgeon doesn't have anything for you afterwards, then that might not be the best surgeon to go to.
Yeah, good. Well, we're trying to keep a list in our practice of the surgeons who we know and
Mm-hmm.
trust. I'm up to like 6 or 7 different surgeons right
Mm-hmm.
now. Um, and so it's helpful to get some kind of reference to, since coming into this fresh as a patient who's just learning about this, you may not have that resource.
Yes,
So
yes.
talk to your doctor,
Mm-hmm.
talk to your occupational therapist, your CLT, just to get some insights for the patients out there and get the right reference for those
Are
surgeons.
you finding any surgeons in your area, or do people have to travel?
There are a couple in our
Very
area,
good.
but they don't take
Ah,
insurance.
yes.
And
Or they
so the
don't
ones
take
who do take,
Medicare, and that's can
yeah,
be a problem. Yeah.
some of them, yeah, it could be any insurance or it could be just Medicare, but there are there are surgeons out there who are specialized in lipedema,
Mm-hmm.
do a lot of lipedema
Mm-hmm.
cases, and they take insurance and can get the insurance authorization done for
Mm-hmm.
you.
Yeah.
So that's always ideal.
And it is ideal if you could have someone in your area, but many women travel. Some of them even travel
Yeah,
to Europe to have it done. But that's not ideal because it's expensive, and also how much aftercare are you going to get close by to that surgeon? So it's best if we have someone who is in their area.
yeah, yeah. Let me ask a question that I've had. I wonder about contraceptives with estrogen in
Mm-hmm.
it
Yes.
or hormone replacement.
Mm-hmm.
What is, or do you have any opinions about this or experience with women who start taking estrogen and what happens to their lipedema?
So I haven't had and noticed that as a trigger point myself, but there's many papers out of Europe that they're talking about that the onset or the exacerbation of lipedema occurred with chemical contraception. That is just like a huge trigger point that has been noticed in those European papers. I haven't seen them
So
here.
taking the birth control pill, using a birth control patch,
Yes,
something like that.
yes. But then now hormone replacement. There's been several papers that talk about this strange dichotomy that some women with lipedema do HRT and their symptoms improve. And others are doing HRT and that's when it really takes off and gets worse. So I think that we're going to find out there's different phenotypes of lipedema, and what we need to do is identify, which is which, so the woman has more guidance. I mean, she may want to do HRT for her bone health and various things like that, but she's afraid to do it because it might make her lipedema worse. How can we guide her? How can we let her know which one she's going to be? And so we're trying to find biomarkers and things like that that can help identify that. But right now it's a big unknown for a lot of women, and they're unsure if they should go on chemical contraception, if they should go on HRT. It's an unknown.
It's like a doctor's worst
I
nightmare.
know. It is. It is.
Someone comes in and says, "Should I be doing this?" And you say, "Well,
I don't know.
it could make it a lot worse, or it could make it a lot better." And I don't know.
Yeah.
You'd be like, "Well, you're useless."
I know. I know. I know. And the only thing is that hopefully, as we experiment, it's not irreversible. You go on it, your symptoms get worse. Okay, let's stop. I mean, there are, I was just hearing about there's some bone health medications, like if you have osteoporosis, and that those drugs, their half-life is like 2 decades. So, once you start that, then it's, oops, But I don't think that's the case with hormone replacement or chemical contraception. I think that if we find it's not good, then we stop, that hopefully it's not irreversible damage that we've done.
Yeah. Yeah, I kind of wonder, for cancer preparation, they do biopsies and test the tissue to see if it's estrogen responsive.
Mm-hmm.
Maybe we could have some luck there,
Yeah,
but
that's it.
I'm not doing that research, so
Yeah, that's an interesting
yeah,
question. That would be cool to look into that. Yes.
yeah, it would, huh? Well, what would, from your point of view, maybe there's a doctor watching. What advice would you give a doctor or an advanced practice practitioner on one thing that you wouldn't want them to do when you encounter
Yeah.
someone who has lipedema but maybe doesn't know it yet?
Yeah. Well, I think I would want them to have the compassion and say, hey, it's not your fault. I mean, I believe it's not their fault with obesity too. But with lipedema, you've been following everything for what you thought was obesity, and it hasn't worked. And I would like that doctor to say, that's not your fault. I'm not sure what I'm supposed to do, how I'm supposed to help you, but no, this is not your fault. I think that's the most important thing. And then I like what you've done, Doug. In your practice, you've reached out to find those people to refer to, because no doctor is going to be alone in taking care of that patient with lipedema. They need to know what vascular specialists, what endocrinologists, what surgeons, what CLTs, that they can refer and have this team of people that is going to help that person. And so don't try to do it on your own, and hopefully don't just say, I don't know. Reach out and try to help that patient find a team that's going to help them.
If I were to answer my own question here, I would say don't let that patient go without letting them know that lipedema is a thing.
Yes, yes.
That's the most important part. If you ignore it or don't even identify it, then it never gets addressed.
Yeah,
And that's hard.
yeah.
So, okay, let's say that that there's a patient watching, someone who thinks they might have lipedema or someone who knows somebody who might have lipedema. Let's go over these resources again so they know where to turn to get some info.
So I would say go to Lipedema Simplified.org. I think the website is lipedema-simplified.org. And there is, on the homepage, there is a quiz. And you take the quiz, and it will send you a thing immediately to your email saying, you look like you might have lipedema because the way you answered the questions on the quiz. And here's your next step, here's some providers that you can contact. And so we have the Lipedema Provider Directory. It's a world map, and you can find people to go to, hopefully in your own community. And then, as we also already talked about with the Learn, lymphaticnetwork.org, I think you said, that is a place also to find a certified lymphedema therapist in your community, because that's going to be your next contact. First, trying to self-diagnose potentially, and then go to your doctor and find a lymphedema therapist in your community.
Good, good. Okay, so let's say they get some info. They're able to find somebody. They're able to get going and get some treatment. How can they support this mission more? Should we talk about June
Yes.
being Lipedema Awareness
Yes.
Month? What's going on in June? Because that's coming up.
Yes, yes. So Lipedema Awareness Month, a lot of organizations that I said have activities. And if you just put in your search engine, Lipedema Awareness Month activities, you'll probably come up with several websites. So one thing that we're doing at Lipedema Simplified is that we have these, I forgot what we call them, but they're kind of like round table meetups, and people in communities are getting together and just showing up at a cafe or a park or whatever, and they're getting together. And for a lot of women, it's the first time they're getting together with other people who look like them. And so it's a way of getting support and increasing the awareness. We have people that are they reserve a place, and they're doing these activities. And one person, she said she had the cards to advertise her meetup, and she just put them in various places in her community, in a cafe, in her doctor's office, in various places. And she said people came just because they found that card and there was a picture of someone with lipedema on it, and they go, oh wow, I think I want to go to this. And it's a very emotional gathering, let me tell you. So that's one thing we do. There's a ton of stuff online, free webinars for that person who can't get out of their house. So basically we come to them, and they can do stuff online, awareness activities. Many people who start with going to that online awareness activity, next year they're running the meetup in their community, so they're becoming involved that way. It's a great month and a lot of great activities. So I would just do that. Go to, put that in your search engine, and you will find a lot of stuff happening.
Yeah, I just plugged that in. I see social media advocacy, support in local groups,
Mhm.
virtual summits and webinars. Really cool.
Yes.
It does say here that purple is the official color of lipedema.
Oh, now I
Is that
hadn't
like
heard
the,
that, but I just know that
and
saying. Hold
you're wearing
on.
purple.
Yes. Yes.
And purple is our clinic color
Oh,
too.
wonderful.
So maybe we should confirm that before
Yeah.
we let it out. But this social media post
Mhm.
here says, "Wear purple, the official color of lipedema
Mhm.
awareness." Interesting. Um, so, I mean, one other thing, you can, if you get onto these social media sites and follow them, then you get their posts and you get the updates and you just become part of that community and you know what's going on when there's something new coming out.
Yes, they will send you those email notifications that this is happening. Yep.
Yeah, yeah. So that's cool.
Mhm.
In our clinic, we're doing evals for lipedema,
Very good.
um, and using as many resources as we can, connecting with certified lymphedema therapists who know what they're doing, ordering compression stockings, compression pumps.
Hmm.
It's a labor of love
Hmm.
because there's a lot of prior authorization
Yes.
hoops to jump through to
Yes.
get those covered by insurance.
Yes.
But we've had quite a bit of success getting quite a few items for patients who really need it, and it's really helping.
Hmm.
The vibration plate's a wonderful idea. I
Yeah.
love that.
Add that one. Yes. In,
So,
in Arizona, everybody has a pool, right? So, you know,
right. So the water
encourage them to get into
therapy,
the pool.
yeah. And how much does that help actually?
Well, there's so many properties in water that really help with both lymphedema and lipedema. One is that when you're standing in water, the compression on your feet is quite a bit, and it gradually gets less till you get to the surface of the water, and that's sending fluid this way. So it is wonderful. It's like a compression garment, but it feels a lot of times more comfortable than a compression garment. So, and then you add the exercise, the movement in the water, and you're really facilitating circulation. And the other thing is that a lot of times when you're really heavy, exercise on land can be painful. You can't move very well, but when you're in the water, you have that support of the water, that buoyancy that can help you move at a greater range of motion with less pain. So I really encourage my patients to get into the water if they're able to. There might be access issues, you can't, a lot of people can't use those ladders. They need to have steps or a ramp. And also there's a little bit of body dysmorphia, uncomfortable with how their body looks, and going to a public pool with a bathing suit can be tough first step. So, helping them through those issues so that they can get into the water is going to be hugely beneficial for many people.
Yeah, that's great insight actually. Yeah, a lot of our patients have pools. We have a lot of physical therapy places around that have
Yes,
pools. If they're doing skilled physical therapy work.
yes,
So great ideas. Um, I mentioned earlier that I put a lipedema section on my website,
yes.
dougmorettymd.com. It's under the topic library. So I'm going to update this with all the info we got today.
Excellent.
This is really cool. Try to connect with as many resources as we can. Um, I have some listings of some surgeons on here that we've worked with directly that may be a benefit. But I mean, ultimately, it would be nice to have a much stronger network of information. We're just getting started, I guess, and the information you guys have pulled up has been amazing for our patients as well
Okay.
coming in. I know that they're looking at it and that they're grateful that it's out there. Um, and we're seeing the needle move a little bit on insurance coverage in terms of the ability for patients to get covered care through their insurance. So specifically for the compression garments, the pumps, the lymphedema therapy, and also for the surgeries. So that's encouraging.
Yes, very good. Yeah, I know that there's been
Yeah.
some new guidelines that have come out that it is, that it's making it easier for women with lipedema to get surgery. That helps. The Lymphedema Treatment Act transformed and allowed coverage for compression garments if you have a diagnosis of lymphedema. And so I would ask the physician to really assess the person carefully and see, do they have swelling? You know, yes, you see the lipedema, but the lipedema diagnosis alone will not get their garment covered. But if they also have a diagnosis of edema or lymphedema, then they can get covered. So see if they have that comorbidity. Do they have swelling because they have venous insufficiency? Do they have swelling because of, you know, any a variety of conditions along with lymphedema? Then that is going to help them get covered. If they have just lipedema, then they're going to be paying for their compression on their own.
Yeah, I think in most cases we can provide an appropriate diagnosis that actually covers their equipment. So I'm just remembering too, I have the lipedema quiz on my website
good.
here. And then the Lipedema Summit, June 10th to June 12th.
That's one
So
of
that's
those
coming up.
awareness activities that's happening, yes?
Yeah, yeah. And then just to remind everybody about the books that you've put out, the Lymphatic Code, and then the one on the ketogenic diet.
The ketogenic solution for lymphatic disorders, yep. And then
Okay,
the
yeah.
latest, our medical textbook, Lipedema, Principles and Practice of Diagnosis and Treatment. And that is a medical textbook.
Okay, I'm gonna have to look that one up. That was the one that was released just barely, right?
Yeah, just a couple weeks ago.
Okay. Well, any last words for people who might be watching, whether it's doctors, other practitioners, patients, anybody just interested, anything that we might not have covered that's just searing a hole in their brain, just wanting to know?
Well, just for people to know there is hope. Even if you've struggled with this for decades and haven't got appropriate care, things can get better. If you can get into someone who is a knowledgeable physician or find a certified lymphedema therapist in your community, there is hope. There is things that can be done. There are things that, and you will have improvements even if you've had this a long, long time.
Yeah, I will echo that. We're treating patients of all ages into their 70s, 80s, 90s,
Wow.
and people are getting relief from a lot of ailments. Although I will add too, I wish we could get to these patients earlier.
Yes.
But in all honesty, I didn't know about it 20 years ago or even 10 years ago. And so I've had patients come and go from my practice that I've missed. So maybe we can do better in the future, but and I hope we can.
Yes.
But for everybody's sake, we should.
Yes.
Well, thanks for joining me. It was great to talk to you face to face. Thanks for your lecture at the Obesity Medicine Association conference. That was excellent. And for your books, for your involvement with the Lipedema Simplified. And it's just great to see everything you're doing. So good job on being an amazing person, working hard to make everybody's lives better. So thank you.
Thank you very much. It's been wonderful
Yeah.
meeting you and being here.
Yeah, thanks. Okay, well, I hope everybody enjoys it. We'll be posting it on as many sites as we can and working with the June Awareness Month to make sure that we can get the word out for lipedema. And uh, if you know anybody, or if you are somebody who might have lipedema, come get care. Come see if we can provide something to you to make your life better. So that would be amazing. All right. Well, thank you,
Thanks.
Leslyn. Yep. Take care.
Bye-bye.